Hey guys, this is Dr. David Lang with Lang Chiropractic in Athens. I wanted to talk about a condition that we see quite frequently and one that is tremendously painful and uncomfortable to deal with, and that is going to be hip bursitis. Bursitis in the hip. Now that sounds like a condition some elderly person would only have, like your grandmother. However, it can strike a lot of different age groups. So McKenna here is going to demonstrate a couple of tests we use to help identify this condition. So before we get to the test though, we're going to talk about what it feels like when you have bursitis. Bursitis will feel like a very sharp pain right in the side of your hip. It will be very tender to the touch. So when you palpate the hip, you're going to get very tender, so they might jerk away a little bit when you're trying to feel the greater trochanter or the bursa cap on the femur here. Also, it will be painful to walk. It can even be really painful to lay down on at night to sleep. So bursitis can affect your sleep, affect your walk. It can also give you a secondary low back problem, make your low back sore and uncomfortable just from the way you compensate and move from walking differently. So one quick and easy way we use to identify bursitis is to do something called a very simple clam test. So McKenna, in a clam test, we're going to have you lift your knee all the way up, and let's first do a negative test. Okay, so in this test we will have her just lower her knee nice and smooth and controlled as she can go all the way down. Okay, now back up. Now a positive clam test would indicate bursitis or a weakening of the glute med muscle. So now let's do a positive test. And a positive test, you're going to notice a lot of shaking in the knee as they lower it down as smooth as they're able to. So bursitis usually has its root causes in a weakening of the gluteus med muscle. So what we do in the office, once we've identified that this is in fact bursitis through an exam, testing, and proper x-rays if needed to rule out other things, then we'll prescribe exercises to help strengthen the muscles of the hip and the glutes. Okay, also help strengthen the pelvis and the stabilizer muscles of the low back. So clam test is used to both identify and to treat bursitis. In addition to the exercise, it's important during the patient's course of treatment that we're utilizing therapy modalities too. We might do ultrasound and electrical muscle stimulation right over the greater trochanter and the bursa of the hip. We'll also do some KT taping in this region, and that seems to provide tremendous relief for it, perhaps even speeding up the length of time during a flare-up. So anyways, if you guys have any questions about this, or if you suffer from bursitis or know someone who does, feel free to give us a call and we can evaluate and see if we can help them. Thank you.